Medications play a crucial role in managing and treating various health conditions, from chronic pain to anxiety. However, certain drugs, while effective for their intended purposes, may inadvertently impact brain health, particularly when used over long periods. For those over 50, this is especially concerning, as the risk of cognitive decline naturally increases with age. In this article, we'll explore 8 common medications that may affect brain health, potentially causing memory loss, confusion, or even symptoms resembling dementia. Whether you take these medications yourself or know someone who does, understanding their potential risks is essential. Let's dive into the details. Statins, the double-edged sword of cholesterol management. Statins, such as atorvastatin and simvastatin, are among the most commonly prescribed drugs for lowering cholesterol levels and preventing cardiovascular issues like heart attacks and strokes. While they've been hailed as lifesavers, their impact on brain health has sparked debate. How statins work. Statins reduce cholesterol production in the liver by inhibiting a specific enzyme. This lowers bad LDL cholesterol, which is excellent for heart health. However, cholesterol is also a critical component for the brain, as it maintains nerve cell membranes and facilitates the communication between neurons. Potential effects on brain health. Statins can cross the blood-brain barrier, potentially reducing cholesterol levels in the brain. This may lead to memory lapses, difficulty concentrating, and mental fog. Additionally, statins may lower levels of coenzyme Q10, a vital antioxidant that protects brain cells from oxidative damage. Insufficient coenzyme Q10 can increase the risk of cognitive issues. What to do? If you experience cognitive changes while taking statins, speak with your doctor about adjusting your dosage or exploring alternative treatments. Antidepressants, a double-edged approach to mental health. Antidepressants, particularly tricyclics like amitriptyline and clomipramine, are life-saving for individuals struggling with depression. However, their effects on cognitive function can't be ignored. Mechanism of action. Tricyclic antidepressants work by altering neurotransmitter activity, particularly acetylcholine, which is essential for memory, focus, and mental agility. Cognitive concerns. Blocking acetylcholine can lead to forgetfulness, difficulty concentrating, and trouble solving everyday problems. Even newer antidepressants like SSRIs, for example, sertraline, can affect brain function by altering levels of serotonin and other chemicals. Older adults may be particularly sensitive, experiencing confusion or disorientation. What to do? If you notice cognitive side effects, consult your healthcare provider about switching to a different medication or adjusting the dosage. Anticholinergics, a hidden threat to cognitive health. Anticholinergic medications block acetylcholine, a neurotransmitter that facilitates communication between brain cells. These drugs are used to treat conditions such as allergies, overactive bladder, and depression. Common examples include diphenhydramine, also known as Benadryl, oxybutynin for bladder control, and amitriptyline, an antidepressant. Risks to the brain. Prolonged use of anticholinergic drugs has been linked to memory problems, confusion, and an increased risk of dementia. In older adults, these effects can be more pronounced, leading to mental fog and difficulty performing daily tasks. What to do? Discuss the potential risks with your doctor and explore safer alternatives if you're concerned about cognitive side effects. Benzodiazepines balancing anxiety relief and brain health. Benzodiazepines such as diazepam, commonly known as Valium, and alprazolam, also known as Xanax, are frequently prescribed for anxiety, insomnia, and seizures. While effective, their impact on the brain is significant. How they work. These drugs enhance the activity of GABA, a neurotransmitter that slows brain activity, promoting relaxation and sleep. Cognitive side effects. Difficulty forming new memories, mental confusion, and slowed thinking. Long-term use can lead to cognitive dependence, where the brain struggles to function optimally without the drug. What to do? Use benzodiazepines only for short-term relief, and consider alternative treatments like cognitive behavioral therapy, or CBT, for anxiety or sleep disorders. Proton pump inhibitors, or PPIs, stomach relief at a cognitive cost. Proton pump inhibitors, including omeprazole and esomeprazole, are widely used to treat acid reflux and stomach ulcers. However, long-term use has been associated with potential cognitive risks. How they affect the brain. PPIs can interfere with the absorption of vitamin B12, a nutrient critical for nerve function. They can also cause hypomagnesemia, a condition characterized by low magnesium levels. Symptoms: memory lapses, difficulty focusing, and an increased risk of dementia in older adults. What to do? Limit PPI use and consider dietary changes or alternative treatments for acid reflux. Opioids, managing pain with caution. Opioids like morphine, codeine, and tramadol are powerful painkillers. While they provide relief, their impact on cognitive function can't be overlooked. Opioids bind to receptors in the brain, altering pain perception but also slowing brain activity in areas responsible for attention, decision-making, and memory. Side effects can include mental fog, memory problems, and excessive drowsiness. Use opioids as a last resort and explore non-opioid pain management strategies like physical therapy or mindfulness practices. Antipsychotics, powerful drugs with cognitive trade-offs. Antipsychotics such as haloperidol and risperidone are essential for managing schizophrenia, bipolar disorder, and severe mood disorders. However, their impact on brain function warrants caution. Antipsychotics block dopamine, a neurotransmitter involved in motivation, memory, and attention. Cognitive side effects can include slower thinking, difficulty with planning and organization, and trouble maintaining focus. Regularly evaluate treatment effectiveness and side effects with your doctor to balance the benefits and risks. Antiepileptics, controlling seizures at a cognitive cost. Antiepileptic drugs like topiramate and phenytoin stabilize electrical activity in the brain, preventing seizures. However, they can also impair cognitive function. Common issues include slowed mental processing, memory difficulties, and fatigue and drowsiness. For some individuals, these effects can interfere with daily activities and reduce quality of life. When managing seizures, the primary goal is to control the condition effectively without compromising brain health. This requires a collaborative approach with your healthcare provider to ensure that medications are working as intended while minimizing any cognitive side effects. Share your concerns about cognitive changes with your doctor. They may adjust your medication dosage, switch to a different anti-epileptic drug with fewer cognitive side effects, or explore complementary therapies. Schedule periodic evaluations to assess both seizure control and cognitive function. Your doctor may use tests to measure your memory, focus, and overall brain health, ensuring that the treatment remains balanced and effective. In some cases, using a combination of lower-dose medications instead of a single high-dose drug can reduce side effects while still providing seizure control. Discuss this possibility with your healthcare team. Adopt habits that support overall brain health, such as maintaining a healthy diet, engaging in regular physical activity, and managing stress. These steps can help enhance cognitive function and counteract potential side effects of medication. Follow your prescribed treatment plan carefully. Missing doses or abruptly stopping medication can worsen seizures and increase the risk of cognitive complications. Always consult your doctor before making any changes. Protecting your brain while taking medications. If you or someone you care about is taking medications that may impact cognitive function, there are practical steps you can take to protect and maintain brain health. Understand the risks. Ask your healthcare provider about the potential cognitive side effects of your medications. Knowledge is the first step toward prevention and effective management. Schedule routine appointments to monitor your brain health. Early detection of side effects allows for timely intervention, minimizing their impact. Don't hesitate to bring up concerns or questions during medical visits. Your input is vital in creating a treatment plan that works for you. Consume a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Foods like leafy greens, nuts, and fish high in omega-3s are particularly beneficial for cognitive function. Engage in regular physical activity to improve blood flow and oxygen delivery to the brain. Aim for at least 30 minutes of moderate exercise most days of the week. Sleep is essential for brain repair and memory consolidation. Strive for 7 to 8 hours of quality sleep each night, and establish a calming bedtime routine to promote restful sleep. Keep your brain active with activities like solving puzzles, playing memory games, or learning new skills such as a language or musical instrument. These activities stimulate neural connections and improve cognitive resilience. Interacting with others helps boost mental health and cognitive sharpness. Join a club, participate in group activities, or maintain regular communication with family and friends. Keep a journal to note any cognitive changes such as memory lapses, trouble concentrating, or mood shifts. Share this information with your doctor during checkups. Pay attention to symptoms like confusion, frequent forgetfulness, or difficulty completing daily tasks. These could indicate that a medication is affecting your brain health. Work with your doctor to determine the smallest dose needed to manage your condition effectively. This minimizes the potential for side effects. For conditions that allow temporary medication use, taper off under medical guidance as soon as it's safe to do so. If you found this information helpful, consider sharing it with friends and family. Raising awareness about these potential side effects can help others make informed decisions about their health. Together, we can prioritize not just living longer but living well, with sharp minds and healthy bodies.